guys, my name is Crystal. Welcome to my YouTube channel. This is part 2 of Good Health by Julie Cook. My GP told me I had asthma, but the problem was heartburn. So occasional heartburn, which usually involves a burning pain for a few minutes when food regurgitates, is quite normal and something many people experience at some point. But it is defined as Gerd if the symptoms become more persistent, bothersome and include severe reflux, which is problematic because it can lead to long-term complications. Risk factors for Gerd include obesity, pregnancy and hiatus hernia, where part of the stomach bulges above the diaphragm. But Kirsty never experienced any reflux symptoms, so assumed her doctor's diagnosis of asthma was correct. Her problems began in 2008 with what seemed to be a cold. But after Kirsty, a property manager from Nottingham, had shaken off her snuffles, a persistent cough remained. I couldn't get rid of it and was breathless all the time, she says. Her GP prescribed antibiotics for a chest infection, but her symptoms were so bad she was constantly wheezing and could only breathe when propped up. Further tests followed as her GP suspected pleurisy, where tissue between the lining of the lungs and the rib cage becomes inflamed. An X-ray was clear but revealed a fractured rib. It turned out I'd fractured my rib through extreme coughing, she says. Finally, after weeks of coughing and struggling for breath, her doctor diagnosed her with asthma. He gave me the blue reliever inhaler and told me to puff on it whenever needed, said Kirsty. She duly went home and used it as instructed for several months without any changes. But at a check-up with a nurse a year later, she was given a peak flow test which cast doubt on that diagnosis. She recalls, the nurse took one look at my results and said, "You're not asthmatic. Your peak flow is too good." I felt concerned. Still suffering, she returned to her GP in 2010, this time seeing a different doctor. I explained I was still breathless and the diagnosis of asthma must have been wrong because the inhaler did nothing to ease the symptoms, she says. This new GP listened to my symptoms and simply said, "You've got Gerd." I had no idea what this even was. Kirsty was referred to a gastroenterologist who performed an endoscopy where a tube with a camera was inserted down her esophagus. And she was formally diagnosed with Gerd, but she wasn't offered any treatment after diagnosis. And for 6 years, Kirsty kept coughing constantly. She eventually went back to her GP, who referred her for a barium swallow test, which examines the throat and food pipe while the patient swallows a liquid. This detected chronic inflammation and revealed Kirsty had severe Gerd. The doctor said this may have caused her breathlessness. Kirsty was prescribed lansoprazole, a drug that would stop her stomach making acid. Within days of taking the pills, she began to feel better. A tightness I'd always felt in my middle went away, she said. My breathlessness improved. I still had a cough, but that sense of never getting a full breath went away. Kirsty, now 50, no longer uses her inhaler. I still take PPIs which have regulated my breathing, but I am hoarse a lot of the time and cough a lot, she says. Dr. Hoare adds that while not all will have Gerd, if you're diagnosed with asthma and are getting heartburn, it's worth thinking, why don't I treat my heartburn for a while with a prescription antacid and see if my asthma gets any better. So that was a piece in the Daily Mail.